Are you suffering from anemia due to chronic kidney disease, rheumatoid arthritis, and any other chronic inflammation? What if I told you that taking iron supplements regularly can reduce your hemoglobin? Would you believe me? Now let's find out in this video. In this video, I will be talking about iron deficiency anemia, how we acquired iron deficiency anemia, and also mainly I will be talking about iron deficiency anemia in chronic inflammation. I will also be talking about the natural cure, how to improve your hemoglobin naturally, and also I will be discussing the iron supplementations, the technique that you need to do in order to have a better absorption. So please stay tuned to the end so you will know how to take your iron pills. The dosing technique, it is very important because if you're not taking it the right way, you will aggravate the condition. Your hemoglobin will not be corrected or improved. Iron deficiency anemia. Iron deficiency anemia is also known as microcytic hypochromic anemia. Why? Because in the microscope, the structure of the red blood cells appears smaller than normal size. And in the center of the red blood cell, there is a central pallor area because the hemoglobin content is very low. And that is why it's called microcytic hypochromic anemia. Erythropoietin is the hormones produced by the kidney to send signal to your bone marrow to produce hemoglobin. Now this erythropoietin is very sensitive to oxygen. Anemia. There are several types of anemia, but in this video I'm going to focus only on iron deficiency anemia in chronic inflammation. You are considered anemic if your hemoglobin is below 11.0. If there is hypoxia or loss of oxygen supply to the tissue, particularly if the kidney is damaged in the case of chronic kidney disease, your erythropoietin will increase, sending a signal to your bone marrow to produce more red blood cells to compensate the loss. In developing country, iron deficiency anemia is very common due to malnutrition, particularly in children. Now, in developed country, the usual cause of iron deficiency anemia is due to blood loss or intravascular hemolysis. Now, another cause of iron deficiency anemia is an increase in demand. So, in the case of pregnant women, they need more iron. Another way of getting an iron deficiency anemia is malabsorption. The diet is enough. We have plenty of iron in the diet, but the body cannot absorb and utilize the iron for erythropoiesis or red cell production. The last one that can cause iron deficiency anemia is chronic inflammation. Chronic inflammation can produce iron deficiency anemia due to the productions of inflammatory cytokines. And these inflammatory cytokines can trigger an iron deficiency anemia. So how chronic inflammation causes iron deficiency anemia? External stimulus that cause inflammation to the body, like for example, eating inflammatory foods like barbecue ribs, which are rich in omega-6 and advanced glycation end product, can cause inflammation to the body. Drinking high sugary juices can cause inflammation. Eating food with monosodium glutamate, drinking a diet cola due to aspartame can cause inflammation. Prolonged exposure to ultraviolet rays to the sun is also damaging to our body, and study shows that prolonged exposure to sun can cause cancer, skin cancer. Eating fried food due to high omega-6 content is also an inflammatory stimulus. Now, any bacterial infections, parasitic infections, viral infections can cause inflammation. Genetics, if you have the genes, you have the bad genes that can cause chronic inflammations, then this can also lead to iron deficiency anemia. Epigenetics, how our body responds to the external environment, is also another factor in developing iron deficiency anemia. Surgery, major surgery can also cause an inflammation, and this could lead to iron deficiency anemia. This could lead to rheumatoid arthritis, any other autoimmune diseases, and can also lead to iron deficiency anemia. Now, all the inflammations in the body, all the inflammatory food that we take in, all of this will boil down to one common denominator, which is an increase in cytosolic calcium, an increase in calcium ions inside the cell, not the calcium outside the cell, not the calcium that we tested in our blood work. The saturations of calcium ions inside the cell will likely bind to calcium calmodulin dependent protein kinase. Now, there are a lot of protein kinase inside the cell. There are several types of protein kinases inside the cell. We have the calmodulin 1, calmodulin 2, calmodulin 4, AMPK, and in this video, we are only going to focus calcium calmodulin dependent protein kinase 4, abbreviated as CAMK4. Now, when the saturation of calcium binds to calcium calmodulin, this can cause productions of inflammatory cytokines, productions of uh, tumor necrotic factor alpha, productions of transformation growth factor beta 1, and interleukin 6. Now, in this video, we focus on interleukin 6. Interleukin 6 can initiate the autoimmune and non-autoimmune response. So anemia and chronic inflammations are actually initiated by pro-inflammatory cytokines known as interleukin 6. Interleukin 6 will stimulate your liver to produce iron regulatory hormone called hepcidin. Hepcidin will block the absorption and recycling of iron, causing iron deficiency anemia. The natural remedy is to block the effect of hepcidin by radiation, ultraviolet sunlight, but since not all of us can stay longer in the sun, and it's also dangerous to prolong the exposure to ultraviolet rays, then the best alternative is to take over-the-counter vitamin D3 in a large doses. Now, but first, you need to talk to your doctor to measure your vitamin D3 to determine your dosage. Now, if you are very low, you can take 5,000 units of vitamin D3 in the morning and 5,000 international units in the afternoon. Now, the doctor usually prescribe you with D2, which is 50,000 units, and should be taken once per week. But in the studies, I believe that taking vitamin D3 in a divided doses, one in the morning, one in the afternoon, is more effective in blocking the effect of hepcidin. So by blocking the effect of hepcidin, you can improve your hemoglobin. And that's one of the natural cure that I'm talking about. Here are the studies about oral iron supplements increase hepcidin and decrease iron absorption from daily or twice daily doses in an iron depleted young women. So taking iron daily or twice a day can increase the production of iron regulatory hormone hepcidin and therefore can block the absorption of iron. So it is not good to take iron daily or twice a day. Now, this is another study, iron absorption from oral iron supplement given on a consecutive versus alternate days and a single morning doses versus twice daily splitting dose in an iron depleted woman, two open label randomized controlled trials. This is the result of the study. The result we studied, the interpretation is in iron depleted women, providing iron supplements daily as divided doses increases serum hepcidin and reduces iron absorption. But providing iron supplements on an alternate days, that means every other day, and in a single dose instead of 2 times a day, optimizes iron absorption and might be a preferable dosing regimen. So the best way to take iron is to take it every other day, alternate, what's one single dose, not two doses, but one single dose alternating every other day. And you can have a better absorption of iron. We did it, we've experienced it, I've observed it, and it works. So this could also work for you. But the only problem is if you keep eating inflammatory, the only problem is if you keep eating inflammatory foods, these pro-inflammatory cytokines will also come back because this is a vicious cycle and your anemia will also come back. So you have to take vitamin D. So talk to your doctor because you have also to monitor your calcium and phosphorus when you take vitamin D. So talk to your doctor about this. Here are the evidence in the course of my investigation. This lab work, CBC, was taken on May 13, and the result was 8.5. After taking vitamin D3 in a divided doses for 3 days, 5/17, 2019, hemoglobin rises to 10.0. If you like the video, please click subscribe and hit the notification bell so you will be notified on my next post. And my next video will be about benefits of turmeric in chronic kidney disease and other chronic inflammations. Now, I also need to add the natural way on how to reduce your blood pressure because reducing your blood pressure, you can also reduce the progression of your kidney disease. Thank you. My name is Glenn Vale, and I thank you for your time.